Deputy Director of the Health Office at USAid Zimbabwe here in Harare. And USAid, which stands for the U.S. Agency for International Development, began operating in Zimbabwe since shortly after Zimbabwe's independence and has provided more than $3 billion in development assistance to Zimbabwe to help the people to improve health outcomes, improve agriculture, economic growth, food security, and democracy governance. Specifically in the health sector, USAid has provided, last year alone, $120 million to improve HIV and AIDS, family planning, tuberculosis, malaria, and maternal and child health. In Zimbabwe, the HIV epidemic continues to be a major problem. There are approximately 1.5 million people living with HIV in Zimbabwe, which represents approximately 50% of the entire population. Each year, approximately 62,000 new infections are reported, and a higher proportion of adolescent girls and young women bear the burden of that disease. Some of the successes we've seen to date include the number of AIDS-related deaths declining. However, we still see the number of new infections increasing, and we really need to make sure that the transmission of HIV continues to decrease in order to ensure that we meet the targets that we're trying to ensure that we get to for UNAIDS 90-90-90 strategy. And that is that 90% of the people estimated to be living with HIV know their status, and of those, 90% are on treatment, and of those, 90% are virally suppressed. USAid and other partners through the PEPFAR program, working with key stakeholders, including Global Fund and the Ministry of Health and Childcare, are strengthening their health system through the national distribution of life-saving ARVs. For example, last year, USAid has provided $23 million worth of ARVs, and they also have provided technical support to the ministry to ensure that these medicines are delivered on time to health facility to ensure that patients get the medicines at the right time when they need them. USAid, with other partners as part of the PEPFAR program, has ensured that nearly all pregnant women seen at health facilities receive prevention to mother-to-child care services. So this ensures that their unborn babies are free of HIV infection. So we're really proud to be able to help the Ministry of Health and Childcare and the government of Zimbabwe on that front. And another success is the ensuring that life-saving ARV treatment is available to nearly 1 million people, and we estimate that with the monthly enrollment rates that this will continue in the next year. USAid, through the PEPFAR program, is really excited to undertake this new initiative called DREAMS. It's targeting adolescent girls and young women to ensure that they stay determined, resilient, empowered, AIDS-free, mentored, and safe. We will do this by reducing the HIV infection among girls and young women by 40%. And through this, we will provide a package of core interventions that are targeted to young girls and young women. These include educational subsidies, health services, providing prevention messages for HIV, and also cash transfers to ensure that the households are able to provide for these young girls to ensure that they stay in school, are provided with enough food so their nutrition is maintained. So these are some of the core interventions as part of the DREAMS initiative that we're excited about. Since October of 2015, we've reached nearly 200,000 young girls and boys to ensure that they receive a package of services that include HIV prevention messaging as well as core interventions so that they are ready and prepared and poised to stay HIV negative. USAid, through the PEPPER program, is implementing a very exciting, innovative model called CATS. It's the Community Adolescent Treatment Supporters Group, in which adolescents aged 18 to 24 who are HIV positive provide a peer support for other adolescents who are HIV positive and would like to continue to maintain their life-saving ART treatment. And this is a really good way for adolescents who have barriers accessing healthcare services at the public health facilities to be able to have that support system, to maintain on treatment, to discuss different ways that they can remain virally suppressed so they don't have a higher chance of transmitting HIV to partners, as well as to ensure that they have the confidence. In addition, as part of the CATS model, adolescents provide other types of services and identify other peers who are struggling in schools or at homes or other kinds of issues they may be facing in relationships, for example. So once the trained adolescents identify their peers, they can refer them to psychosocial services and as well as other services that they may need to follow up and ensure that they stay and remain healthy.
These and other stories, visit our website www.263chat.com. Follow us on Twitter @263chat and like our Facebook page 263chat.